Suggested skills and attitudes towards patients with psychosis. Care from the family is helpful and essential towards the healing process of the patient. However, there may be situations when negative emotions are created when the caregiver's concern is misinterpreted as anxiousness by the patient. Sometimes, family members tend to show negative emotions like worries, anxiety, or frustration due to concern about the patient. We should be more aware of these emotions during communication and try to express these feelings in an alternative way. Communication is a form of art. Other than using language and actions to show your thoughts and feelings, effective communication also leads to a form of emotional exchange, resulting in a closer relationship between the caregiver and the patient. The following are some common techniques and things to be aware of. The attitude. Think and judge from a positive viewpoint. Focus on the patient's talents and improvement. Encourage him or her frequently. For example, you can say, "I really appreciate your courage and patience in accepting this therapy." Or, "You really helped a lot with the housework. You are so considerate to your family." Replace judgments and comments with care and consideration. Show care and support to patients. Avoid judgment and harsh comments. For example, you can say, "You look a bit tired. Is something bothering you?" Do not say, "I don't like your attitude. You refuse to answer any questions." Use caring actions and languages more effectively. Show your concern and acceptance through language and action. For example, you can say, "You don't look very happy. Is something wrong? Let's go for a walk." Or, "I wrote you a letter. Read it when you have time." Listen patiently and encourage each other. Listen to the patient before speaking. Strive to understand his or her struggles and difficulties. For example, you can say, "Yes, I understand that these situations will make you frustrated." Do not say, "Stop complaining. You've been throwing a fit about your problems all afternoon." Strive to grow. Learn more about the disease. Avoid blaming the patient's character for his or her actions. For example, you can say, "Maybe the medications is the cause of your drowsiness and lack of concentration." Do not say, "Why are you not working? You are so lazy." Express yourself patiently and give him or her the space to express themselves. Repeat patiently when not understood. Avoid talking when not in a good mood. For example, you can say, "I understand that you are very angry. Let's take a break and talk about it later." Be aware of your own expectations and standards. Avoid overestimations. Be flexible in having expectations to avoid unnecessary stress. If you are too tired to work, for example, you can say, "If you are too tired to work, would you mind helping me with some housework instead?" Do not say, "You've been doing well in school all along. You can do better if you work harder." Be open and enthusiastic about communication. Create conversations and open up chances for emotional connection and support. Try to stay focused on one topic each time. For example, you can say, I had a new colleague at work today. How was your day? Do not say, my expectations are simple. First,